Good morning. Please be seated so we can begin the session this morning. My name is Ken Olson, and for the past 18 hours I am president of IFOMPT. I want to thank MACP for the fantastic conference they've put on for us this week, particularly Chris Mercer, and as chair of the committee, as well as Mindy Carnes for her efforts with the scientific committee. It's been outstanding. I have a few announcements. Remember to use the app for any questions that you have for our two sessions this morning, and also to provide feedback for those sessions. If you're registered for the gala, there's a table sign-up board in the exhibit hall next to the registration desk. So you can go pick your table and your seat where you will sit. Cocktails begin at 7:30 and the seating for the dinner is 8:15. So if you're registered for the gala, please take a look at that table sign-up. And it should be a lot of fun with a bit of dancing after dinner, I believe. The South African MO members have asked to have all the South African members stay after this morning's session for a group photograph here in the auditorium. Without further ado, I want to introduce the recent past Vice President of IFOMPT and New Zealander, Duncan Reid, to introduce the winner of the Maitland Award.
Thank you very much, and thank you very much to the organising committee for such an amazing conference. I feel very privileged to present this award. Geoff Maitland was an outstanding physical therapist and clearly one of the founding members of IFOMPT, so it's fitting that we have this award, and the recipient in Quebec was Bob Alvey, equally fitting given that he is also an Australian. Just to lead into this though, I'd like you to look at the purpose of this award, to acknowledge an individual who has made an outstanding and lasting contribution to the clinical practice of orthopaedic manipulative physical therapy, as exemplified by the professional career of Geoff Maitland. This nominee has to be a member of an IFOMPT member organisation, have positively and substantially influenced the shape, scope and quality of OMT practice, significantly influenced other physical therapists in a manner that has enhanced their ability to practice OMT and contributed to the overall and widespread validation and or development of OMT. The guidelines in the selection process looked at the duration of clinical practice, the substantial effect on shape, scope, quality of OMT, the effect on other physical therapists' abilities to practice OMT, the effect on the development of the evidence base of OMT, and the quality and quantity of contributions to IFOMPT member organisations and IFOMPT in general. It is with great pleasure as a New Zealander that I announce that Brian Mulligan is the 2016 recipient of the Maitland Award. Brian, if you could please come up on the stage. Just come and have a seat for a minute. I'm just going to take a few moments to go through Brian's illustrious career, and I know he hates this sort of thing, but I think it's important that we understand that those characteristics that I've just described so ably meet Brian. So Brian qualified as a physiotherapist in New Zealand in 1954. He's been married to his wife Dawn in 1956, and that in itself is an amazing feat. He's 84 years old and still travelling the world teaching manual therapy. He gained his DIP-MT in 1974 and has been made an honorary fellow of the New Zealand Society of Physiotherapists in 1996. He's a life member of the New Zealand Manipulative Physiotherapists Association and a life member of the college and is a fellow of IFOMPT. And he was honoured at the World Confederation of Physical Therapy Conference in 2007 for his services to physical therapy. Together with JC Cameron and Robin McKenzie, he established the New Zealand Manipulative Therapy Association. He represented New Zealand at the IFOMPT meeting with Stanley Paris in Amsterdam in 1970, and IFOMPT representative in Vail in 1997 and Sweden in 1982. He was chair of our educational trust for a long period of time that set up our educational program and was always responsible for teaching the extremity section within our program for many years and was an examiner on that program. He's been on the international lecture circuit since 1972. At the time of writing, he has taught in the US, over 85 cities, as well as the UK, Australia, Netherlands, Germany, Ireland, Malta, and you can see the list goes on. He's a teaching fellow at the University of Otago and at Curtin University. But Brian is famous, as we know, for his MWM. The worldwide interest and demand in his courses in this new field of combining mobilisation with movement was such that he could not keep up with the demand, and it resulted in the formation of an international group of teachers in 1995. This was set up at the request of the German, Dutch, Canadian and British manual therapists, and this group is now called the Mulligan Concept Teachers Association. There are currently 55 members in 20 nations. These courses are now attended by doctors, osteopaths and chiropractors. From an evidence perspective, there is now a lot of evidence around this approach. Just a quick search on Google Scholar will show you that there's 2,240 hits when you put in the words MWM. There are books, journal papers, randomised controlled trials. We've had the conference presentation yesterday from Josh Cleland using an MWM to treat ankle pain. It is a key part of manual therapy curricula around the world. The book Manual Therapy, Nags and Snags was produced in 1989. It is now in its 6th edition and has been translated into 10 languages. His book Self-Treatments for Back and Neck Pain and Limbs was produced in 2003 and is now in its 3rd edition. One of Brian's favourite quotes is that in the field of discovery, chance only favours the prepared mind. Thank goodness Brian Mulligan was prepared, an amazing individual and a worthy recipient meeting all of the criteria of the Geoff Maitland Award. Thank you, Brian.
I'm used to speaking before large audiences, but not under these circumstances. I'm really quite overwhelmed. I'm deeply honoured and I'm humbled to receive the prestigious Geoff Maitland Award. Dear Geoff was a wonderful, manually skillful and innovative physiotherapist with a brilliant mind. His contribution to our knowledge in the field of physical medicine was huge. He was also inspirational. He was one of the founding members of IFOMPT, as we've just been told. And the first time Geoff presented his concepts outside Australia was in New Zealand in the early 1960s. And in those days, I happened to be on the conference committee in Wellington when we were having a conference. And Geoff came across and he was our keynote speaker. And would you believe it, he stayed with Dawn and I in our home. And that was a special privilege. Dawn remembers him fondly because she couldn't believe how he made her feel at ease in his presence. And it was a genuine feeling that she got from him. And dear Geoff, he was obviously to her and to all of us a man of stature. In accepting this award, I am indebted to many people. And I'm here because of many, many people. Firstly, Stanley Paris. He alone instigated IFOMPT, the foundation or the setup of IFOMPT, which made him very special. He came back to New Zealand in the 1960s after studying in Europe, where he met Freddie Carlton-Bourne and others. And when he got back, he arranged a weekend, 2-day program for about 10 of us in Wellington. And at that presentation was Ian Searle, the late Ian Searle, and he became IFOMPT's first secretary, and he held that role for many years. Also at that meeting was Robin McKenzie. And Robin, well, he just added so much to my knowledge. He was an incredible guy. But I really owe ever so much to Freddie Carlton-Bourne, because he came to New Zealand and he taught me to manipulate every spinal joint. Yesterday I saw somebody, I shouldn't have done this, but in the audio-visual room or something, and he said he'd like to have his neck manipulated. So I said, lie down. And I went clunk. And I thought, that's fun. But anyway, he taught me to manipulate every joint in the body, and he also gave me my mobilizing skills. And without those skills, I would never have succeeded. I must also include Jenny McConnell's and dear the late Bob Elvey's knowledge contributions to our profession. I felt guilty when I was told that I was receiving this award and that I was at this huge international conference and not contributing in any way. So I asked the IFOMPT executive if I could have some time to just share some things with people who are attending the conference. And this they have done. Now, I'm keeping an eye on the clock. I have 3 sessions scheduled. One is on ankles, knees, etc. The second one is on shoulders, headaches, and tennis elbow, and maybe the AC joint. And the third one is on chronic backs, maybe the sacroiliac, hips, and the muscles around the hips, around the hips. And if you've not done our concepts and you come along, I'm making a promise to those that are coming, with my fingers crossed, thanks to Jeremy in his presentation, how when he tells a little untruth, he's got his fingers crossed. But I promise you that those people attending will learn at least one thing that they can use on their patients next week. And I'll keep that promise. Early in the year, I had an introduction to a group of doctors in Auckland that I was teaching, and I made the following claims about mobilizations with movement. And I said to them, in the field of musculoskeletal medicine, there is no other hands-on manual therapy procedure that, when indicated, and I'm talking about the entire field of musculoskeletal medicine, there is no other procedure that, when indicated, gives you an instant pain-free result. And I remember saying that one day in America, and a guy said, "You can't say that." He said, "I can get instant results with muscle energy techniques." And I said, "Of course you can. I totally agree. But do they work on a sprained ankle?" Oh. I make the claim for the entire body, not just sections of it. Manipulation will give you, without any discomfort if you're clever, an instant result. But I'm just making that claim. It takes 2 or 3 minutes to decide if they are indicated. And I've got a gentleman coming out shortly, and he had a problem for 3 years. And he'll tell you it took 10 seconds to get rid of it. So there we are. It takes less than 2 or 3 minutes to see if they're indicated. And if they're not indicated, go through every other option that you have to treat your patient. When indicated, it's diagnostically significant. I have people referred to me, or I see them on stage when I'm lecturing, who have pain when they move their arm. And if I have 12 or 10 people come on stage, as happens in the States, 2 of those people will lose all their pain when I do a very simple thing to the cervical spine. So to me, that's indicative that diagnostically, if you like, Their problem's coming from here, and it's got nothing to do with the arm. It isn't a rotator cuff, subdeltoid bursitis or whatever. Now, my success rate would be 75 or 80% when I'm with colleagues. Now, I belong to a Probus club that's filled with old people, and if my success rate with them would be about 7%. But with you people, I would claim 75 or 80%. And I'm saying that because I want now to recruit victims for my 3 programs that I'm running. And if you do have a chronic back, if you do suffer from headaches, if you've got a shoulder problem, if you've sprained an ankle recently, if you've got anything wrong, I would, if I was you, come along. And those people on that course will see if I am telling the truth when I'm talking about a 75 or 80% success rate. So there you are. And you can also see how long it takes to decide if a mobilisation with movement is indicated. So I'm formal at the moment. I cannot wait for these 90-minute sessions. I'm excited already. And you'll see why when I bring a patient out. While I have you all, can I speak of my concerns about our profession? Here, this is a huge manual therapy conference, so I've got a wonderful audience. The speakers are brilliant. Their mastery is faultless, and they are all contributing to knowledge. 40 years ago, our profession had no academic status at all. All you did was treat patients, but we had no academic status. How things have changed. Academics now dominate, and PhDs, I've never seen so many. And in Australia, more physiotherapists have PhDs than doctors. Now, that tells you the level of intelligence that these people have and where we're going academically. But manual therapy has declined alarmingly in the schools. And I am truly, deeply concerned. Now, can I just mention one condition? There's a condition called tennis elbow. And a study was published in the British Medical Journal confirming that mobilisations with movement were effective and in fact better than corticosteroid injections. And that study was the first study in a manual therapy, physiotherapy procedure to ever make the British Medical Journal. And it turned out it got an award for being one of the best articles in that journal last year or the year before. And what they found that if you had mobilisations with movement, you got better well, you felt better almost straight away, and you made a complete recovery. If you had injections, they made an instant result. But at the end of 12 months, everybody in the study that had an injection had recurrences. Not one of the 31 people in the study that had mobilisations with movement had a recurrence. Now, you talk about you need evidence for manual therapy. That's the best evidence that's ever been presented on a manual therapy procedure. It gets an award from a medical journal's point of view. And is it being taught? It's not being taught anywhere. I despair. Now, what else? I've already asked. Yes, I'm going to have some fun now. Could that gentleman come up, please? Where is Graham? Graham. Thank you. Yesterday, I go to the audio-visual room, and you'll confirm that everything I say is truthful. There are 2 gentlemen there, and one's helping me, and when he finds out what I'm doing, he said, "Can you do anything for my neck?" I said, "Sit down." So I snagged it, and I said, "What I'm about to do to you causes no pain." So he was happy with that, and I snag him, and he starts to go around. And things start to change, and then I showed him how to do it, and then I did something else to him, and he was quite impressed. Now, I talk about I have a success rate of 75 to 80%, but I've got 2 patients. How are we doing? And so this gentleman comes out, and bless him, I'm so grateful he was disabled.
Thanks very much.
He said, I've got a knee problem. Oh, now I really light up. And I said, what happens? He said, I can't squat down. I said, how long's it been like that? He said, 3 years. Oh, I said. And did you have treatment?
I'd been to the physiotherapist after I had an operation on my knee, and it got better as time went on, but it was still remained stiff, and it was stiff for 3 years. It was painful to squat down, quite unpleasant at times.
Oh, quite unpleasant. I was in 7th heaven. I said, 3 years, that's not long. Where's your pain? And he points to where his pain is. So I said, come here. And I put a finger on his joint, and I pushed as he flexed. And how long did it take for you to, from the time I put a finger on you, and for you to squat down with no pain?
Well, I think we did it 2 or 3 times. And
yeah, but the first time?
Yeah, well, the pain had sort of, it went. It felt funny at first.
Oh, yeah, I know, we all laughed.
Yeah.
But, I wanted to say about 5 seconds. How long, when I put my finger on and you go down, how long did it take?
Okay, it was pretty much instantaneous. There you go.
Instantaneous. After 3 years.
Uh-huh.
Look, you couldn't believe it, could you?
No.
If you'd seen his face, and then I showed him how he could do it himself. And if you come to my program on knees, I'll show you. And he now does it himself. It's so wonderful that 3 months ago, I had a sore knee. Now, many of the people I mentioned today, I said the late, and the late this. Well, I'm getting there slowly. I've got premature, if you like, rigor mortis. That's as far as I can bend. And that's as far as my arms go. So you can see I'm on the way. But I've got a sore knee. And I thought, I wonder if I can help it. So I did to my knee what I've shown you to do to yours. Would you agree? And bless him, he does it perfectly. And even his mate was sitting there practicing himself so that if he had a sore knee, he knew what to do for it. Now, I just want to thank him for coming out, thank him for having a bad knee, and he also confirms that it's long-lasting, because that was yesterday, and he's had no pain since. So
I'm a very happy man as well.
Yeah, and you know, if he dies tomorrow, that proves it was really long-lasting. But anyway, thank you. Thank you, thank you. Now, I've got a few minutes, and I'd love, is anyone in this room got tennis elbow? There's got to be out of hundreds of people. Now, can you see anyone? No? At the back, come out, quick, I'll fix it. Please, quick. I've got 7 minutes, 30, oh, bless you. There's nothing wrong with her legs, and I don't mean that in a disrespectful way. Oh.
Behind you.
Oh, you've got tennis.
I've got tennis elbow.
Oh, bless you, coming. Oh, come here, quick. You've got tennis elbow too.
Come on.
Come on, quick. All right, I'll treat one of you and you treat the other.
Oh, God.
Now, I want you to grip. And that's pain.
Yeah.
Thank you. You're the same?
Yeah.
Right. I am going to use a mobilization with movement technique. I'm going to reposition her ulna on the humerus, which isn't really funny, all right?
No.
I'm pushing that across, and I'm going to ask you now, when I'm pushing it, to pronate and grip and tell me if it still hurts. Now, don't do it yet. Now, turn it over and grip. Does it hurt?
No.
Now, this should be known. Every physiotherapist in the world should be able to do this for tennis elbow. I'm just going to do it again. Turn over, grip, really hard, and let go. Now, anybody, even if they're not very competent, should be able to push that across. I'll show you, I'll prove it. Come here for a minute. I want you to push her ulnar across, hold her funny arm. Yeah. Now, don't grip with your thumb, just push that across. Is that the same?
Oh, yes, perfect.
Thank you. Turn your hand over. Does it hurt?
No, it's a miracle.
Now,
Seriously.
but it takes the pain away. Now, I'll tell them how to do it properly. Your tennis elbow will be fixed. And if you don't believe me, bring up the British Medical Journal, because you're in England.
I'll be in touch.
Yeah. Now, let's try the next person. That arm, fix her.
Okie dokie.
Yep, up there more. Yeah, and don't put your thumb in there unless you want to get a neurological problem. That's it.
We don't do that, do we? No.
Now push, turn over, and grip. Any pain?
Minimal.
Ah, well, you're not as good as me. Right, now, turn over, grip.
None.
None! But look, you're young enough to get better. All right, I want you now to put that part of your finger there, push it across yourself, turn over and grip, and you should have no pain, if you've got it correctly.
No pain.
Good girl. Can you do the same?
Did it.
You did it.
Yes.
Perfect.
I want you both to do that with maximal contractions 10 times. Now, by maximal, you can't do that. It takes a couple of seconds to do a big grip, all right? Don't pull faces because you're on camera. Look, really grip and let go. Really grip and let go. Now I'm working on your brain while you're doing it. Come on, really grip.
I like the brain part.
Yes, the brain part, I'm not forgetting.
No.
And you're on medication?
Yep.
Yes, oh God, it's a pill. At your age, that's good. Come on. Huh? All right, you done 10?
Yep.
Put your arm out and do that. Does it hurt?
No.
No.
No, wait. One of our Aussie colleagues gives injections. I should have got him to inject one. Well, I did the other. But you now will be asked to, I think in the study, they asked people 6 times a day to move it across and do 10 maximal contractions. When the study was started, they measured the strength or the grip strength of everybody in the study, and they were seen twice in the first week. They came back in, they checked they were doing their exercises, they checked their grip strength, and the people in the study were happy because they saw they had a better grip. They could see it was being recorded. And then they were seen at the end of 6 weeks, and during the time virtually, they had no pain. They kept doing this, and a year later, they had no recurrences. Now, you will both clear your tennis elbow, you'll save the National Health Service a lot of money, and you'll be able to play tennis.
Perfect. Thank you.
Goodie.
That's good. I've never played
I think it's very good.
Thank you.
Goodie. 2 minutes 40. The other thing I must mention with mobilisations with movement, I can't believe I still get excited doing what I do. To be able to have a knee that hasn't bent for 3 years and to be able to fix that in 10 seconds, which is rare, sometimes it takes longer, but to be able to fix it like that, the patient was excited, but so was I. It does something for you, it does something to you. It's the most satisfactory career I could have ever had, and I did it by chance. I can't believe, I wanted to become a military infantry officer and go to Duntroon, and I failed the eyesight test. And if I'd been a soldier, I would have had wonderful ability to kill people. Yeah. I would have lent out a bayonet, shoot, gas them, do anything. And I failed. And by chance, I became a physiotherapist, and I've had the most miraculous, wonderful life. I say to my wife, why me? And I want you all to be able to do what I do, because I just want you to have the same enjoyment, the thrill, the fun of treating patients successfully. But can I thank you for your attention? And remember, if you've got a problem, please turn up on these sessions. And I've got video films if you don't turn up, you know, because I hate telling you what I can do. I want to show you what I can do. And that makes a hell of a difference. And it should make you want to learn to do what my teachers will tell teach you to do. Thank you. Thank you, Ken. That's my ordeal over. Hold it. Hold it. Take a photo. Just a minute. Come up here. Take a photo. Come here, quick. Quick, quick. Run. Hurry. Run. Run, quick. Take a photo. Quick.